So this ROCI lecture will focus on providing some strategies for developing a letter of intent as you are preparing to apply for residency or for a fellowship. So the first thing I wanted to start with is a section on resources that I found helpful as I was writing my letters of intent as a student applying for residency. The ROCI resource page will have a lot of those available to you, and so I've submitted all of those there. And those were all ones that I used during my preparation. Some of them are actually sample letters, so you can sort of see what the flow looks like and what people include. Some of them are just sort of general documents that discuss things to include, things to not include, and make sure you address, a lot of which will be discussed during this lecture. The next reference is the Pharmacy Professional's Guide to Resumes, CVs, and Interviewing. This is actually available through Pharmacy Library that you have a subscription to as an ETSU student online. And they discuss the types of letters, how to prepare a letter, and provide samples to you as well. There's another book, Securing and Excelling in a Pharmacy Residency, and then the ASHP Student Forum, if you're a member of ASHP, has a lot of helpful resources for you as well. Alright, so the first thing I want to talk about is some stylistic considerations. A letter of intent isn't going to necessarily make or break you as a candidate, but if you're someone that is sort of a midline candidate for programs, it can be a really good screening tool at this point. There's an article that I found that discussed from an RPD perspective the explosion in the number of applicants combined with the compressed timeline for review of residency candidates has put a greater emphasis on the quality and content of a candidate's application. And so candidates need to try and differentiate themselves more so in this process than they used to. They can't rely on the interview to really do the talking anymore because there's more people trying to get to even that interview stage. So you want to make sure that your letter doesn't exceed a 1 to 2 page maximum. Most of mine were about 1.25 pages, 1.5 pages. Always defer to the residency sort of handout or pamphlet as to what their rules are for the letter of intent for length. You really want to highlight the most important characteristics and bypassing some of the lesser ones for the interview. You should use 11 to 12 point font, usually single space, and then really make sure that you spell check and not just relying on Microsoft Word, but printing it out and reading it yourself and sharing it with others, because sometimes you spent so much time with that letter you won't catch things. But little things like that are going to sort of show your attention to detail, which is generally a high quality that programs are looking for in candidates, is sort of a work ethic and attention to detail. Also, if you're referencing a program, a certificate, an internship type experience that you've had, make sure that you have done your research and use the exact title. I know that might seem like splitting hairs, but that again is something to differentiate sort of your work ethic, your attention to detail, like the previous factor. And I've reviewed letters before for people seeking membership into honoraries, and they refer to the honorary by the incorrect name, and that can really be something that puts you on the chopping block. For text, try and stick with Arial or Times New Roman. I know that Mac defaults to another text, and it doesn't look bad, but I usually encourage people just to stick to those two. And then make sure you know who to address your letter to and follow the standard letter format. So include your contact information, the date, their contact information, and then your greeting and getting into the text of your letter. Alright, so where do you start with a letter of intent? I know as a student I sat at my computer screen staring at it for a good 30 minutes just being overwhelmed with where do I even begin with this, and putting a lot of sort of pressure and sort of weight on this letter. So what a letter of intent should be is it should be a tour through your CV and your transcript for the program, highlighting the experiences that you've had that make you a candidate for their program and why you'd be a good fit for them. So start with that. Write down a list of your education, your experience, maybe meetings that you've been to, certificate training programs that you've experienced, internships that you've had, and start to write down what you had that align with that program and make you someone that's on that career trajectory and a good candidate. What do you bring to the table? The next thing is make a list of why that program. So Why do you want to go there? It shouldn't just be that you want to do a residency. That program needs to have something that they bring to the table for you that you can really sell how you're a good fit for each other. So do they have specific rotation offerings that you're really interested in? If you're interested in transplant medicine, do they have a transplant rotation available for PGY1s? And then also PGY2, if you want to specialize in ambulatory care, do they have a PGY2 ambulatory care that you could potentially stay on for? Also, what are maybe some career opportunities of their residents that you are interested in following in a similar path, and you know that they prepare their residents to take on those types of positions? And then why residency? It shouldn't just be, I want to do residency because I want to be a clinical pharmacist or because I don't want to dispense. You need to really sell how this is going to prepare you for the next stage of your career. So what are your career aspirations, and how will this residency program help to get you there? So for me, where I matched with Ohio State, and they had a very strong teaching component. I was a TA in a course for a semester and taught 2 lab sections every week, and then also coordinated some small groups for journal clubs and things like that, as well as gave 2 large room lectures. And so I knew that program was going to really give me a good experience of what academia looks like, and if I wanted to truly pursue that, as well as hopefully improve my teaching skills along the way. For drafting your letter of intent, use those previous guiding questions to form a base. Really try and write one letter that you have key components for that you modify for each program on that specialization piece. It makes your life a lot easier to write one letter versus 8 or 12 letters, depending on how many programs you are applying to, and to just make small tweaks. Draft it through multiple settings, maybe write a certain section at each sitting. After it's all done, take some time away from it and come back, because you're going to see different things that you might not have. You're going to realize you forgot something. And then also make sure other people look at it and read through it. I know it's not always fun to have someone else read your writing, but they can pick out things that maybe you don't notice, like grammatical things, statements that you might mean one thing, but it comes off a different way. And then make sure you understand the difference between a letter of intent and a cover letter and a personal statement, which that pharmacy resource and pharmacy library will discuss. Alright, so the actual format of a letter of intent, there's not necessarily a hard and fast rule. Different resources will suggest different things. This is sort of a conglomeration of all those pieces and parts, and making sure that you're addressing the key things as well as the format that I followed. It'll say paragraph 1, paragraph 2, and paragraph 3, but a lot of times I'd spend 1, maybe 2 paragraphs on each section. So for paragraph 1, you should open with a statement of interest. So why are you interested in that program? How did you learn about them? If you've attended showcases, I always make sure to include that, what showcase I went to and who I spoke with and what I discussed with them that was really of interest to me about that program, because hopefully they're going to be like, oh yeah, I remember talking to so-and-so at the residency showcase and they really impressed me and they were really in tune to the future of the profession, or they really had a passion for infectious disease and I think could really learn a lot from our program and bring a lot of advancement to some of the initiatives we have for that program. For the next section, should really speak to why that program appeals to you. And so this is more so getting into the meat and potatoes. So why that residency program specifically? What are your visions for the future practice of pharmacy? Where do you think the profession's going? What are some things that we need to work on? And maybe how is that program allowing you to do that? Or how are they leading that? What are your specific career goals? What position or specialization do you want? And how is that program going to provide you with experiences to get there and to achieve that? Also, what are your goals for residency? So what do you want to gain from that? Do you want to get a lot of teaching experience? Do you want to start to develop an ambulatory care practice site? And are you wanting to pursue that? And tying how that residency will get you on track for that. And then also you want to incorporate why you're pursuing residency in general. So do you want to gain a greater knowledge of the practice of clinical pharmacy? Do you want to gain a more robust knowledge for evaluating the clinical significance of therapies for patients and learning how to evaluate things from an evidence-based perspective, tying in some of those pieces and parts about how this is going to make you a better pharmacist in general. And then the wrap-up section should sort of be what skills and interests you have that make you a good candidate. So what sets you apart, and what do you bring to the table that other candidates might not bring or might not be as qualified in? So what strengths in leadership and education has made you pursue this? So what about your pharmacy experience has set you on this path? What skills and experiences do you have that will allow you to be successful? So this is sort of, think about maybe your strengths from StrengthsFinders. If you've had experience within ambulatory care as an intern, what has already set you on the trajectory of success? What have you experienced in the past that's going to make you able to succeed in residency? You also want to address the bad. So if you didn't have a stellar semester and barely passed a course, if you had to remediate a course, you should address that in the letter of intent, because they're going to see that in your transcript. And it's better if you can say, yes, like I came into pharmacy school, I struggled in this module, but I remediated it, I feel confident in this knowledge, and that experience made me a better studier. It made me value the course in a different way. I learned how to better manage my time from that experience. And also, did you take any additional courses that weren't required to better prepare yourself? So a great example is the diabetes management elective through Dr. Hess, or the ambulatory care elective through Dr. Calhoun if you're wanting to go down the ambulatory care route. Or do you have certifications or experience that will enable you to thrive in that program? Alright, so what are they looking for within a letter of intent? What's sort of the overall purpose of this? A lot of times programs are just wanting to try and use this as a way to making sure that you're a good fit for them and they're a good fit for you. So they don't want to match just to match. They want to match with a purpose where that resident is going to be able to improve some of their quality improvement projects and work on those so that there's better care for the patient. Maybe they want somebody to really invest time in developing a new clinic site that they want to start providing. They want to gauge your writing and communication skills as well. So some of those soft skills that someone with a stellar GPA might have some weaknesses in. And it's not going to buy you the interview, but it is a helpful screening tool now. So if you're a candidate that is sort of midline for them, or if you're someone that has a strong letter, it's going to help get you through to the next stage of review. And it may be a differentiating factor. In my personal view, it's easier to see who you are as a candidate, what you bring to the table, and what you want to do with the profession of pharmacy through this letter versus through your CV. Alright, so in the closing of your letter, make sure to thank them for their time and for consideration. Some people will put sort of, this is a summary of my curriculum vitae, which is attached. I look forward to discussing it with you further. So that's sort of things to consider in the wrap-up. So that is sort of the basic bones of writing a letter of intent. Again, this is just sort of a summary of big picture things to consider. Hopefully the resources posted will provide some additional information for you, and I hope this was helpful for you in pursuing residency.